Hi, welcome to Healing Tunes. Trigger points cause your muscles to become stressed and to contract, which results in muscles weakness and numbness along with limited muscle movement and severe pain. A trigger point is a tender spot within your muscle, not a bundle of tense, contracted muscle that twitches and spreads that called referred pain. Today, we are discussing shoulder and arm muscles trigger points. Arm muscles. First is the scalene. Scalene muscles uh, refer to two finger like projection into chest. Common pattern are into shoulder, scapula, and down lateral arm into the thumb and index finger. Scalene can impinge on the brachial plexus, causing nerve pain, numbness down the arm. This is called thoracic outlet syndrome. Next muscle is the infraspinatus. This muscle referral pain is deep into the anterior shoulder joint with spill over down the anterior arm. Less common trigger point near the lower medial border refer pain into rhomboids. Infraspinatus works in concern with the other rotator cuff muscles to control the head of the humerus, and these other muscles should be checked for function as well. Next is the biceps braking. This muscle referred pain pattern is up into shoulder with spill over into the posterior aspect of the scapula. Less common into the anterior elbow and forearm. The most common injury into this area is an inflamed upper biceps tendon. In mild cases, cross fibers friction is useful modality to reduce inflammation and stimulate healing. Next is the brachialis. Brachialis main referral into the thumb with secondary pattern in the anterior arm and anterior elbow joint. Next major muscle is the triceps. Long head usually refers pain into the posterior shoulder and sometimes down into the posterior arm, skipping the elbow. Medial head refer into the olecranon process in the elbow. Lateral part of the medial head refer to the lateral epicondyle and are common component of tennis elbow. Medial head, deepest head of the triceps is the workhorse of the three heads. Concentrate first and most forcefully. Next muscle is the supraspinatus. This muscle primary referral is a deep ache in the mid deltoid area with spill over down the arm into the elbow. Next is the deltoid. Anterior deltoid refer into the anterior and lateral shoulder. Posterior deltoid refer into posterior shoulder with spillover down the lateral arm. Deltoid is especially prone to trigger points. Next muscle is the pectoralis major. Clavicular head refer into the anterior shoulder. Sternal head refer tense pain into the anterior chest and medial aspect of arm. Costal and abdominal section refer into breast, causing breast tenderness and nipple hypersensitivity. Left pectoralis major can mimic heart pain. Next is the pectoralis minor. Primary referral pattern is over the anterior chest and shoulder with spill over down the medial arm. Left side can mimic angina. Next muscle is the coracobrachialis. This muscle refer pain into lateral shoulder and down the dorsal arm, skipping the elbow and wrist. Then last muscle is the latissimus dorsi. This muscle refer pain into the inferior scapular area with spill over down the posterior arm and hand. Unusual point refer inferiorly and sometimes into the anterior shoulder. Please subscribe the channel, like the video, share to your friends and colleagues.